Doreen Grand-Pichet is the
Dr. Doreen is an expert in autism.
Doreen Grand-Pichet.
Dr. Grand-Pichet.
Dr. Doreen Grand-Pichet.
Dr. Doreen Grand-Pichet is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Our friend from Ireland says, good morning, ladies. I was hoping you would give me some advice regarding sertraline. My son was previously on, I'm going to slaughter these names, fluoxetine for anxiety, but was changed to sertraline due to increase in his OCD. Started at 25 milligrams, now at 50. On the new tablet, we are experiencing more anger, agitation, and lack of interest in activities. Can sertraline cause these side effects? Also, he also takes guanfacine, 2 milligrams. And obviously, I gave a disclaimer before. You can't prescribe in this, but you can talk about side effects.
Yeah. So fluoxetine and sertraline are both SSRIs, and they are not going to cause those types of symptoms that you're talking about. If anything, sertraline's side effects are things like nausea, dizziness. It is possible, obviously, that he has nausea and that's what's making him angry. That is a possibility, but it is not it's like he could be dizzy and therefore agitated from that. But it is a good it's a good SSRI for OCD type behaviors. Guanfacine could be causing agitation, although 2 milligrams is pretty low. But guanfacine is more for ADHD or, attention deficit. So that's a possibility, but go back and talk to his physician. Also remember, SSRIs generally take 3 weeks to have any kind of effect. So it is also possible he's coming off the fluoxetine, and that's intense. Changing your SSRI is an intense process. So I would try to tolerate about a month of any kind of change and then go talk to the physician because they'll want to adjust things for you.
Okay. Fatasha says, hi, Dr. Doreen. My son is 28 months old, showing signs for ASD, also nonverbal. I'm so overwhelmed and scared, trying to help him before it's too late. Going to ABA, it's a 2.5-hour drive for 12 hours a week on a wait list to get 24 hours, but that's the max what they are offering. Afraid it won't be enough. Will it be successful to become his therapist? Learning ABA and skills he needs to develop, and they're in Holland.
Yeah. Yes. I don't want you. I mean, it's crazy to be driving 2.5 hours. That is just stressful for you, stressful for your child, and just unbelievable. There are a lot of different ways that you can learn ABA through various trainings online. I do heavily recommend that you learn ABA techniques. I don't know, unfortunately, what there is available in Holland. There is ABA in Germany. They're all over Germany. I remember the name of the organization. What I would do if I were you is to look up on the BACB.org website, which is the Behavior Analysis Certification Board, BACB, online. And there they have a list of all BCBAs, board certified behavior analysts all over the world. Although they may have taken down Europe because they stopped governing countries outside of the US, but those are folks who are trained in behavior analysis and licensed in behavior analysis. I would also contact the local universities and try to see if you can find people who are learning ABA at the university level. There are organizations in the US who will provide supervision to you online, but you'll still have to find behavior technicians or behavior therapists. And they don't have to be trained when you find them. You could just find, we've done this so many times with people where they would hire college students in psychology, and then you would get them trained online, and then a supervisor comes on board and develops a program for your child and then helps teach them also what to do. But your child is just slightly over 2, which is wonderful because 2-year-olds are super, super easy to work with, and the team can work with your child. Honestly, in your case, given that you're 2.5 hours away from the closest center, I would focus a lot on that as opposed to trying to get ABA from a center. And it is hard. I see some of the comments coming in. It
Yeah.
is very difficult to find really good quality, high quality ABA. But I think there are signs that you can tell if it's not high quality, because high quality ABA might start with very high level of demand for your child, but over the course of the first few months, your child starts to enjoy it and you see them learning very, very rapidly. I think ABA is the most evidence-based and supported throughout the world because it's very quickly effective. And having said that, we both know, Shannon, there are providers of ABA out there who are just not good, and they're also not able to see the individual as a whole individual. So there's folks out there who might have had a bad experience with ABA, and that's really unfortunate, because there are people out there who are also very, very good and make tremendous progress with your kids.
Yeah, I love the conversation that you guys are having, and I really appreciate Wick has written in and said, that in their opinion, ABA isn't necessarily the be all end all. But I really appreciate Wick what you said, which is that it is better than nothing, and that autistic adults will tell you that and this is what Wick's quote, but I agree with it completely, that old ABA methods are abusive and traumatic. Any teaching method, if done incorrectly, can be abusive and traumatic. So it's so important that if you're going to do ABA, that as a parent, you educate yourself on what true good ABA is, so that you can make sure that the people are doing it properly. And one of the things that we do here, Wick, is talk specifically about that and about making sure that you're getting the good quality ABA, because Dr. Grampiche will tell you that ABA is based on the principle, everything that she's been talking about, that you have to have a good reinforcer or you may not be motivated to do something. That's really the heart of ABA, that it's got to be worth your while. And you'll hear Dr. Grampiche, my favorite quote of Dr. Grampiche's, she says all the time, it has to be fair. That if we're asking you to do something, there has to be a big enough incentive and reward that's meaningful to you. It has to be fair. And when people do ABA wrong and ask somebody repeatedly to do something and there's nothing in it for them, and they don't understand what's happening, that can be abusive and traumatic. So I'm so glad you brought it up, Wick. But I do want to make sure that we tell this mom in Holland that, what Dr. Grampiche just said, it is the most effective way of teaching anyone. ABA, if done properly, it is the most effective teaching tool in the world, and it has tons of science behind it, and it is effective at teaching individuals who are on the autism spectrum, and it does not have to be abusive or traumatic. If you know me, if someone came to abuse or traumatize my child, the forks and knives would come out, right? Like,
Yeah.
my child had 5 years where I sat and watched a video monitor and watched everything that was going on. Nobody was going to abuse my child. So I just want to make sure that we get all those sides of it, because it's so confusing, for the mom in Holland who says, oh, I thought that was the thing. ABA is the thing, but it's got to be good ABA. Let's
Yeah.
be clear about that. Did I leave anything
Yeah.
out?
No, no, no. That was perfect. And I see a little bit of dialogue on here about ABA not being appropriate for higher functioning individuals. So I just want to comment on that as well, because first of all, I want to say that when you're diagnosed, you don't receive a one number. If you do, the person who diagnosed you did it wrong. there are two numbers, and this is something that happens over and over. And these numbers have to do with the severity, not really the severity, but the amount of support that you require. The first number has to do with the amount of support that the individual requires in the area of social communication. And the second number has to do with the amount of support the individual requires in the area of repetitive self-stimulatory, what we call stereotypic behaviors. Now, each of those goes from 1 to 3, with 1 requiring the least support and 3 requiring the most support. And so you can, for instance, have autism or ASD, with the first number being a 1 and the second number being a 3. That means that, for instance, in social communication, the individual requires very little support. That means they're very minimally affected, but they do have ritualistic or sensory issues to an extreme level, and that therefore receives a 3. That individual, I just want to make a point, is going to be a very different individual than someone whose numbers are 3-1, for instance, because that means you have a very severe disability when it comes to language and social skills, but you don't really have stereotypic or sensory issues. See, so it's very important to have both of those numbers, and over time, I don't know why people have kind of forgotten about that and have dropped that off. So that's one thing to just clarify. There are two numbers involved when you get the diagnosis. I wouldn't really put too much into these numbers because they are a subjective evaluation of the clinician who is diagnosing you. If they are doing some form of testing like the ADOS or ADIR, maybe that will allow them to identify what your level of severity or need or support is. And also, the reason that these numbers are not that important is that hopefully they change, right? When you first start in the world of autism, our kids usually require a lot of support because they are learning very, very rapidly and gradually. Obviously, if the education they're receiving or the therapy they're receiving is useful, helpful, then over time, the level of support they need is less. That's the goal of therapy. So ideally, even if you're starting at a 3-3 level, you end up at 1-1 and then don't need support at all. So that's kind of how the process works. Now, I read that a parent who was saying that like it's probably ABA is probably not important, not applicable for very high functioning, let's say individuals who are 1-1, and that they received or their son received CBT, which is cognitive behavior therapy. That's exactly to the point, and social skills. And that's a really, really great example of a good ABA provider because ABA is an over-encompassing, it's applied behavior analysis. And for the higher functioning individuals, you actually do CBT and social skills. And so that's really important to know that cognitive behavior therapy sort of merges with the higher levels of ABA, which are called natural environment training, NET, the higher type of ABA. And so I do absolutely, being a behaviorist, being a psychologist, I very much support CBT. I think it is definitely the right way to go. In fact, I think the type of ABA, which is called discrete trial training, is not appropriate at all for very high functioning people. CBT is extremely applicable, as is NET or natural environment training, which is a form of ABA. So kind of trying to clear up the misunderstandings there.
Amazing. And I have to say, one of the things that makes me crazy is that we hear all the time that families will come to us and say, well, my child has a 1. And I know you go crazy because you want to hear both numbers, but they'll say they have a 1. So the doctor told me they don't need ABA, and the doctor sends them home and says, oh, you don't need that. Your child has so many skills. send them home. And that makes me literally break out into hives, because the actual designation, if you read it, and you mention it, it's about how much support you need. And one says they still need support. They just don't need as much as a 3. But the very nature of it says needs support. But it says a smaller amount of support. So where doctors go, oh, you don't need support, it literally makes me break out into hives. If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
To subscribe, click here. And if you'd like to check out some more of our videos, click here.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time on autism-network.com. We hope to see you there.